stop. Before you scroll past this video, I need to tell you something that could change everything about how you age. What if I told you that your ability to stay independent, move without pain, and avoid dangerous falls after 60 depends on just 3 simple movements? Movements you can do from your living room without any equipment in less than 15 minutes a day. And here's the kicker. Most people have never heard of them. Most people believe that getting older automatically means losing strength, sacrificing mobility, and becoming dependent on others for even the simplest tasks. But that's simply not true. Science proves that many of the changes we blame on aging aren't inevitable at all. They're the direct result of inactivity and a lack of proper physical stimulation. In fact, recent research shows that practicing just a handful of specific, scientifically designed exercises can do far more than simply keep you active. They can slash your risk of falls by more than 30%, dramatically improve your posture, ease chronic joint and muscle pain, restore your balance, and most importantly, give you back the confidence to move freely and safely through your day. And here's the best part. It doesn't matter what shape you're in right now, whether you're struggling with pain, recovering from an injury, or just feeling weaker than you used to. Anyone can start today. So stay with me, because in just a moment, you'll discover exactly what these 3 movements are, why they work so powerfully, and how they might be the single most important tool you'll ever have to protect your independence for life. Exercise number 1, the chair-assisted squat. At first glance, the chair-assisted squat may look like an ordinary, everyday movement, but it's actually one of the most powerful and essential exercises for preserving your independence as you age. Why? Because this simple action, sitting down and standing back up, represents a fundamental daily skill known as a functional transfer. And your ability to perform this movement with strength and ease is directly tied to your quality of life and personal autonomy in your later years. Each time you stand up from a chair, you activate some of the body's largest and most critical muscle groups, the quadriceps, glutes, and hamstrings, along with the deep core stabilizing muscles that maintain your upright posture and protect your balance. Together, these muscles form the essential foundation for walking with confidence, climbing stairs without struggle, carrying groceries or grandchildren, and reacting quickly enough to catch yourself and avoid a dangerous fall. With age, however, the gradual and progressive loss of muscle mass, sarcopenia, becomes one of the single greatest threats to your independence and safety. That's exactly where the chair-assisted squat becomes indispensable. By practicing it consistently, you can slow down or even reverse muscle loss, dramatically improve joint mobility and flexibility, and retrain your body to master one of the most vital movement patterns for lifelong self-sufficiency. Research strongly supports this. A landmark study published in the Journal of Geriatric Physical Therapy found that a 12-week program of chair-assisted squats reduced fall risk by more than 30%. It also significantly improved walking speed, leg strength, and the ability to handle daily activities without exhaustion or discomfort. And this is no small matter. Falls are the leading cause of fractures, hospitalizations, and loss of independence in adults over 65. But the benefits of this movement extend far beyond just strength and mobility. Long-term clinical studies show that the ability to rise from a chair without using your hands for support is strongly linked to greater life expectancy, better cardiovascular health, and dramatically lower risk of disability in old age. In other words, this one simple exercise can actually serve as a powerful predictor of how healthy, independent, and vibrant your future will be. The chair-assisted squat is a perfect example of functional training because it simultaneously strengthens your major muscle groups, improves hip and knee mobility, increases bone density to help protect against osteoporosis, and sharpens the critical brain-to-muscle connection that governs balance, coordination, and faster reflexes when you need them most. For older adults, this translates into something truly priceless: trust in their own body again. The ability to rise from the couch without needing help, to get in and out of the car with confidence and ease, to walk to the kitchen with a steady, sure-footed step, even to dance at a wedding without the constant fear of losing your balance. All of this makes the chair-assisted squat far more than just another exercise. It's a direct investment in your autonomy, your dignity, and your quality of life for years to come. Exercise number 2, the glute bridge. The glute bridge is far more than a simple movement. It's a powerful weapon against the degenerative effects of aging on your spine, pelvis, and the entire core of your body. As the years go by, our stabilizing muscles, especially the glutes, transverse abdominis, and lower back, begin to weaken and deteriorate at an alarming rate. The culprits? Sedentary lifestyles, age-related muscle loss known as sarcopenia, and reduced daily movement. Together, these factors create a vicious cycle of weakness, chronic pain, and restricted mobility that directly robs you of your quality of life. The glute bridge fights back by targeting all 3 pillars of body stability at once. When you lift your hips against gravity, you powerfully activate the gluteus maximus, absolutely vital for hip extension and walking strength, the spinal erectors, essential for maintaining upright posture, and most crucially, the transverse abdominis, often called your body's natural weight belt because of its protective role around the spine. Research confirms this. A comprehensive meta-analysis published in the Journal of Orthopedics found that core activation exercises like the glute bridge not only improve posture, but they also significantly enhance balance and overall functional capacity in older adults. What does this mean for your everyday life? Stronger, safer walking, better stability when bending, reaching, or turning, and genuine confidence when climbing stairs or getting up from a chair. But the benefits don't stop at raw strength. The controlled motion of raising and lowering your hips also retrains the vital communication pathway between your nervous system and your stabilizing muscles. This neuromuscular re-education is absolutely key, because most falls aren't caused by weakness alone. They're caused by a breakdown in postural control when something unexpected happens, like an uneven surface or a sudden shift in balance. One landmark study in the Journal of Back and Musculoskeletal Rehabilitation found that older adults who practiced glute bridges for just 6 weeks experienced significant reductions in chronic lower back pain, along with remarkable improvements in muscle endurance and daily activity levels, all without added discomfort or strain. And here's something few people realize. This exercise also increases blood circulation in the pelvic and lumbar region, delivering more oxygen-rich blood to your tissues and dramatically speeding up muscle recovery. In other words, the glute bridge doesn't just strengthen your body, it actively rejuvenates it from the ground up. The best part? It requires no equipment, no gym membership, no fancy setup, just a little space on the floor and a comfortable mat. That's exactly why it's one of the most essential and effective tools for anyone who wants to stay independent, eliminate pain, and enjoy an active, strong, and safe life well into their golden years. Exercise number 3, the side plank. The side plank is one of the most underestimated and overlooked exercises out there, but it's also one of the most powerful and protective, especially when it comes to preventing falls and serious injuries in older adults. Here's why. Contrary to what many people believe, most accidents and falls don't happen simply because of weak legs or poor lower body strength. Instead, they occur due to a lack of lateral stability and compromised postural control, the ability to stay upright and balanced when forces push you sideways or catch you off guard. Think about it. Every single time you walk, turn your body, step down from a curb, or react to something unexpected, your body depends entirely on deep core muscles and hip stabilizers to keep you upright and balanced. But with age, these critical muscles, particularly the obliques and gluteus medius and transverse abdominis, tend to weaken significantly and lose their responsiveness. The result? A body that struggles to react quickly and effectively to sudden changes in direction, uneven surfaces, or unexpected shifts in balance. That's exactly where the side plank becomes an irreplaceable and life-protecting ally. By holding your body in a strong, straight line supported on just one side, this exercise powerfully activates the deep stabilizing muscles that traditional movements and exercises often completely neglect. It builds what's known as isometric strength, the specific kind of strength that helps you hold steady and stay controlled in real-life situations when your balance is suddenly challenged or threatened. Research published in the Journal of Strength and Conditioning Research strongly confirms this. Isometric core exercises, like the side plank, don't just strengthen key stabilizing muscles, they also dramatically increase postural endurance, which is your body's ability to maintain stability and upright control for extended periods of time without fatigue or loss of form. This endurance is absolutely critical for daily life and long-term independence. It allows you to stay steady and sure-footed even after long walks, while carrying heavy grocery bags or luggage, when navigating crowded spaces, or when changing direction quickly in response to something around you. And the practical, real-world benefits are truly undeniable. Those who practice side planks consistently develop a powerful ability to resist destabilizing forces, whether it's a sudden stumble on uneven pavement, an unexpected push or bump in a crowded street, a sharp turn when reacting to someone calling your name, or even just stepping off a curb at an awkward angle. This matters deeply because extensive studies in geriatric medicine show that lateral falls that happen to the side, are by far the most dangerous of all. They carry the highest risk of devastating hip fractures, an injury that can lead directly to hospitalization, extended recovery, permanent loss of independence, and a sharp, heartbreaking decline in overall quality of life. The side plank works like a protective shield for your body, training your stabilizing muscles to respond instantly and efficiently against any force that could knock you off balance or cause you to fall. At the same time, it actively strengthens the obliques and hip muscles, improving spinal alignment and overall posture while reducing chronic pain linked to poor posture, hunching, and deep core weakness. In short, the side plank is not just about building strength in one isolated area. It's a comprehensive, full-body strategy to safeguard your mobility, preserve your autonomy, and fiercely protect your independence as you age. And when combined with the glute bridge and the chair-assisted squat, it forms a simple but remarkably powerful system. 3 foundational movements that work together to keep you strong, balanced, pain-free, and confident for many years to come. Exercise number 4. Kick to the sky. The kick to the sky may look deceptively simple, but its impact on strength, stability, and overall functional health is truly profound, especially for older adults who want to maintain their independence and vitality. This movement can be performed lying flat on your back or positioned on all fours, but the most effective and engaging version is done from the quadruped position, supported firmly on your hands and knees. Here's how to do it correctly. Place your hands directly under your shoulders and position your knees aligned with your hips. Keep your back straight and neutral, your core muscles engaged and active, and from this stable position, slowly lift one leg upward with the knee bent at a comfortable 90-degree angle, as if you're pressing the ceiling above you with the sole of your foot. At the top of the movement, deliberately squeeze your glutes and hold that contraction for 2 to 3 full seconds before lowering your leg back down under complete control. It's crucial to avoid arching your lower back or using momentum to swing the leg. Precision, control, and stability matter far more than speed or how high you can lift your leg. Start with 2 or 3 sets of 10 to 12 controlled repetitions per leg, taking adequate rest between sets. As your strength and confidence improve over time, you can progress by extending the leg fully straight or adding resistance bands around your thighs for even a greater challenge. When performed correctly and consistently, this exercise doesn't just strengthen the gluteus maximus and gluteus medius, two of your body's most important powerhouse muscles. It also powerfully activates the deep core stabilizers and lumbar support muscles, creating a protective synergy throughout your entire posterior chain that supports your spine, dramatically improves your posture, and enhances your balance during all everyday movements. But the real, lasting value of the kick to the sky lies in its remarkable long-term benefits. By extending the hip through its full natural range of motion, it actively combats stiffness and immobility, promotes healthy joint lubrication, and helps ward off age-related degenerative issues like hip arthrosis, lower back pain, and chronic pelvic discomfort. It also sharpens and refines the critical neuromuscular connection, the vital coordination pathway between your brain and your muscles, so you can react faster, more smoothly, and more efficiently when facing sudden imbalances, unexpected obstacles, or changes in terrain. A compelling study published in the Journal of Aging and Physical Activity revealed something remarkable. Adding hip extension exercises like the kick to the sky not only significantly boosted lower body strength and walking speed in older adults, it also dramatically reduced their fear of falling, a psychological barrier that often limits independence and quality of life just as much as any physical weakness. In daily life, the benefits are crystal clear and immediately noticeable. Walking with a firm, confident, powerful step, climbing stairs without strain, hesitation, or fatigue, bending down to pick something up off the floor without the fear of losing your balance or hurting your back. And perhaps best of all, it's a highly accessible and adaptable exercise, safe, effective, and easily performed at home with nothing more than a comfortable mat, no matter what your current fitness level or physical condition may be. The kick to the sky isn't just another generic workout move or trendy exercise. It's a fundamental cornerstone of active, vibrant aging, a simple but remarkably powerful way to rebuild lost strength, restore deep-rooted confidence in your body, and preserve your precious independence well into the later years of your life. Why these 4 exercises matter. The true beauty of these 4 exercises is that, while they may appear simple and straightforward on the surface, together they form a complete, scientifically validated strategy for physical longevity and lifelong vitality. Each movement strategically targets a different essential pillar of human function. Glute and core strength, glute bridge and kick to the sky, lower body power and functional independence, chair-assisted squat, and lateral stability and fall prevention, side plank. This precise balance is not accidental or random. It's exactly what makes this routine so remarkably powerful and effective. Research published in the American Journal of Preventive Medicine clearly demonstrates that training with compound, functional movements, the very kind you've just discovered, directly and significantly improves independence, mobility, and quality of life in older adults. These movements don't just build superficial muscle size or bulk, they strengthen the deep stabilizing muscles that actively safeguard your balance, enhance your coordination, and protect your everyday mobility and movement patterns. Even more compelling and encouraging, extensive evidence shows that dedicating just 20 minutes a day to exercises like these can significantly increase cardiovascular endurance and heart health, improve insulin sensitivity and metabolic function, lower blood pressure and reduce cardiovascular risk, and most importantly, prolong your functional autonomy and independence well into your 80s, 90s, and beyond. In short, these 4 exercises are far more than simple movements or basic workouts. They're a proven, powerful blueprint for aging with strength, safety, dignity, and unwavering confidence. Last but powerful insight. The benefits of these exercises extend far beyond muscle strength and joint health alone. Practicing them consistently creates a powerful ripple effect that strengthens not only your body, but also your mind, your spirit, and your overall outlook on life. Research published in the British Journal of Sports Medicine shows that older adults who engage in regular, purposeful physical activity experience up to a 40% lower risk of depression and anxiety, along with a marked and measurable improvement in overall well-being, mental clarity, and self-confidence. When you integrate the glute bridge, chair-assisted squat, side plank, and kick to the sky into your daily routine, you don't just gain physical strength and improved mobility. You also gain the genuine confidence to move freely without hesitation, dramatically reduce the persistent fear of falling, and reclaim true independence in every aspect of your daily life. This renewed sense of control and capability fuels a virtuous upward cycle. More movement builds more confidence, and more confidence naturally leads to a more active, engaged, and fulfilling lifestyle. In the end, these 4 simple exercises are so much more than just a workout or fitness routine. They're a proven, powerful blueprint for aging with strength, safety, dignity, and unwavering confidence. With just a few focused minutes each day, you can prevent dangerous falls and injuries, relieve chronic pain and discomfort, improve posture and spinal alignment, and most importantly, gain the freedom to live life on your own terms. If this video was helpful and valuable to you, don't forget to subscribe to the channel. Hit the like button, turn on the notification bell so you never miss new content, and share this video with family members or friends who want to stay strong, healthy, and active after 50. And always remember this powerful truth. You don't stop moving because you age because you stop moving. So go ahead and comment "strong body" below to commit to your strength and independence, and start today, right now. Your body, your health, and your future self will deeply thank you. Thanks for being here. Now go build the strongest version of yourself, and I'll see you in the next one.